You are sitting on the edge of your bed at the end of a long Tuesday, and suddenly you are crying. The immediate reaction is usually a deep sense of embarrassment. If you are in a doctor's office, you start apologizing. If you are alone, you tell yourself to pull it together, convinced you are rapidly falling apart. Viewing that release as a personal failure creates a reflex to swallow the emotion. You wipe your face, take a deep breath, and shove the feeling down to keep functioning. Hiding the tears does not erase the exhaustion or the grief. It traps it inside. By trying to muscle through and stay perfectly composed, you turn a passing emotional wave into a chronic physical burden. Trapped emotion physically manifests. Chronically suppressing feelings generates localized tension, somatic symptoms, concentrating in the chest, gut, and head. Untreated, these pulsing hotspots send distress signals straight to the brain, creating a continuous feedback loop that drives severe anxiety and disrupts emotional regulation. Your body is not designed to carry a heavy, unprocessed emotional load indefinitely. It requires massive amounts of energy to keep that tension contained, and over months or years, that effort steadily breaks your system down. This unexplained breakdown represents an automatic maneuver to vent internal pressure before the system sustains damage. Those sudden tears at midnight never actually come from nowhere. They are the physical evidence of a massive backlog of stress that you haven't had the time, space, or words to address yet. To understand this, we have to look at the parasympathetic nervous system, the network of nerves responsible for resting, digesting, and bringing your body back to a state of calm after a period of high alert. On this nerve cluster pressure gauge, prolonged stress pins the needle in the danger zone. Crying is your nervous system's response to discharge tension. As tears fall, the valve opens, heart rate slows, breathing deepens, and internal pressure drops safely into a balanced state. Your brain might interpret this sudden weeping as losing control, but on a cellular level, your biology is executing a highly effective self-preservation protocol. The nervous system has successfully regulated itself, utilizing a built-in mechanism to keep your physiology intact. This physical reality is exactly why the context changes when these tears happen during a routine checkup in a pediatrics clinic or a primary care office. When a patient sits on the exam table and starts crying for seemingly no reason, medical professionals don't see an awkward interruption. They recognize a high-yield clinical opening. That unprompted emotional release tells the doctor that the patient has reached their absolute physical threshold. The body is audibly signaling that it can no longer carry the accumulated stress on its own. This loss of composure provides the specific clinical data point a doctor needs to initiate a referral for targeted professional support. Simply giving yourself permission to feel and express that emotion safely is in itself a legitimate therapeutic intervention. But biological release has a limit. While your nervous system can vent the immediate physical tension, your mind still has to actively process the root cause of the distress. Notice how the chaotic, tangled lines on the left transition into neat, parallel paths on the right. Therapy acts as an external processor, a structured environment where you can finally attach words to the pain your body just discharged. While crying clears the pressure valve, therapy provides the witness. It ensures that the experiences you've been holding on to are acknowledged, so you can stop carrying the burden entirely by yourself. Coping and healing counseling is a practice built to provide exactly that kind of dedicated environment. Their team of over 15 licensed therapists specializes in organizing the mental tangle caused by severe anxiety, depression, trauma, grief, and relationship stress. Operating a HIPAA-compliant telehealth model, they serve all 159 Georgia counties. They remove financial friction by accepting major insurance like Aetna, Cigna, United Healthcare, and Medicaid, which often means patients pay a $0 copay. This structure guarantees that even patients living in rural or geographically isolated areas have immediate, reliable access to professional psychological support. Your body uses tears to request a reprieve. Starting therapy with coping and healing counseling answers that request with professional support.